All right, you guys, we're back with Dr. Rand, and this is your favorite series, Ask the Doc, and we have some good questions this week, Doc, right?
Yeah, I think so.
Yeah, from all over the world again. So I'm going to let you go ahead and read the first one.
All right, number one. Loving the show, fellows. So refreshing to get some clear, fact-based information. Thank you. I am a 54-year-old Kiwi in good health and have been training most of my life. My goals are health and longevity, physique, and charisma. I'm looking to run an undulating TRT protocol, 4 weeks at 250 milligrams of testosterone and anthate with 3 times Arimidex per week, alternating with 4 weeks at 500 milligrams of test and anthate with 5 times Arimidex per week. What are your thoughts on the benefits or otherwise of this WAVE protocol? Okay, let me stop there. There's more to the question, but that's good because it brings to mind recently. Well, first I'll try and answer this question as best I can. So again, I don't know what your levels are to start with, etc. But 250 milligrams a week of testosterone and anthate would certainly seem to be a good hormone replacement dose. And then, my tastes are to oversuppress, if anything, run the risk of oversuppression of estrogen, at least from the get-go, then undersuppress it. So 3, I'm assuming it's a Arimidex 1 milligram, 3 milligrams, or I would actually bump it to 3.5 in my practice, just because I say every other day per week is fine. Bouncing up to 500 milligrams of test and anthate each week, it's definitely going to be super physiologic, more than likely, and probably don't need that much. But if you're an expensive date, if you burn through it pretty fast, maybe you do. 5 times the Arimidex. I don't know. I'd probably want to see what. Not probably. I wouldn't jump to 5 times 5 milligrams of Arimidex per week with that dose necessarily. I'd want to see how you're metabolizing the testosterone, how much is aromatized, etc. Again, it's probably a pretty safe dose. If we're dealing with the averages, to have 5 milligrams of Arimidex on board, in my experience, you're probably going to still be oversuppressing estrogen. But again, I don't know, and my preference would be to do so anyway. The thing about the reason I stopped is because the WAVE protocol it's a small study, but it's I think it's a 15-person study that showed we can treat prostate cancer successfully using undulating, as he calls it, testosterone therapy. So they were cycling these guys that had prostate cancer on and off testosterone to treat it, and did so successfully.
Oh, wow.
And it brings up the whole thing, the myth about testosterone being a...
responsible.
Well, yeah, certainly it's been blamed as a source for prostate cancer, which we know better now. And I think I've touched on this before, but it's based on an old study, a small study that in hindsight really didn't make much sense to hang our hat on at all. But the current study is pretty positive, but what was I going to say? It's not the testosterone that causes the problem. We all have the genes for prostate cancer as men. We know now that it's estrogen, some estrogens that activate the genes for prostate cancer, and what testosterone can also be converted into, not just estrogen, but dihydrotestosterone that will fuel prostate cancer once you get it. Now, in this study, I didn't see any references to the use of a 5-alpha reductase inhibitor to reduce that conversion to dihydrotestosterone, and yet, by cycling on and off testosterone, which we know now is actually protective for the prostate, they were able to beat down the prostate cancer. That's pretty cool.
Wow.
He also asks, on the use of Anavar, is there any benefit using 5 milligrams per day long term, or am I better to run a standard 6 to 8 week cycle at 40 milligrams per day and then post psychotherapy? Many thanks for your time and wise counsel, Grunta. Thanks for the comment. So 5 milligrams a day of Anavar is actually a very good way to reduce your SHBG, the sex hormone binding globulin, and therefore get more juice for the squeeze, more testosterone in its free form from whatever your total is. You're not going to get any, as a male, any really anabolic benefit from just 5 milligrams of Anavar. And yet, I say that and I'm about to say something else, which is, G.D. Searle in this country, when they made Anavar, used to make it in 2.5 milligram and 10 milligram tabs. one of the things that I find a lot of is someone will say, okay, well, this is a mug. A mug is a mug, and whether I put beer in here or Wild Turkey 101, it's a mug. And there's a lot of that cross-referencing of number, or that number, if you will, with drugs, which is fascinating to me, because we all know, 10 milligrams of Anavar is not the same thing as 10 milligrams of, Anadrol or anything else for that matter. There are, of course, some similarities, but it's amazing what I see, and I see guys who tell me that they're taking, obviously in this country, a bootleg 50 milligram capsules of Anavar, and they're sitting in the chair, 4 or 5 days after they started it, asking me, hey, what do you think they could have put in here, doc? They're sweating, I'm really jittery, and my heart's beating out of my chest. They're taking 50 milligrams of Anavar, which is a substance that can be, by the books anyway, 40 milligrams of Anavar is considered a replacement dose. That's on the high end. Most would consider 20 milligrams of replacement dose. Now, I know we don't want to get into what most and the standard of care, which may be mistaken and all, but my point is that 40 milligrams per day of Anavar is no small dose anyway. It's certainly a pretty hefty dose. You could probably get away with this is probably going to offend some of the bodybuilders out there, but I'll stand by it. Your standard testosterone replacement with 10 milligrams of Anavar twice a day will give you plenty of benefit. Granted, maybe 40 milligrams a day will give you more benefit, but there is a certain limit, and it definitely comes with, I won't call it risk, but certainly the potential for other side effects, like this gentleman who was sweating bullets and his heart was beating out of his chest. So anyway, back to the question, 5 milligrams a day of Anavar is probably not going to do much in terms of the anabolism directly from Anavar, oxandrolone, but it will help because you're going to get more free testosterone, which is obviously anabolic in and of itself. The question of whether to run, Anavar for what it's good for, or what's intended for, the anabolism versus the other, I think I kind of just addressed that in and of itself, but obviously it depends on your goal. You're not going to get the same amount of anabolism from the first thing he proposes versus the second. In other words, 6 to 8 weeks, or really closer to probably 12 weeks of an anabolic, we can do safely. The books will say you want to check your liver enzymes after about 2 months. I haven't seen anyone who uses Anavar have an enzyme elevation at standard dosages, 10 milligrams twice a day, even as much as 40 milligrams. It's when I hear of these people that are taking 50 milligrams of Anavar twice a day that you figure there's going to be some liver enzyme elevation that's because of that, not because they're breaking down muscle tissue or whatever.
Right. I think sometimes people are kind of confused between HRT or TRT and cycling, and that's why they're asking those questions, because there's a difference.
Well, and that brings up the issue. You definitely don't want to be on an anabolic steroid for an indefinite period of time, because with all anabolic steroids, it's rare you can say all, they will all affect your lipid profile negatively, meaning they're going to typically lower your HDL cholesterol and raise your LDL cholesterol. So it is something, for that reason alone, that for medical reasons we use this. You want to get on it, monitor it, and then get off it, and make sure that your lipid panel gets back to optimum, or at least your normal, preferably optimum if your normal is not optimum. But anyway, with the caveat that, as I explained, 5 milligrams of Anavar is such a small dose. Long term, you probably won't. I can't say this definitively, but because you don't have any of the anabolic effect, you probably won't have any of the side effects either. Meaning no negative effect on the liver, certainly, but no effect negatively on the lipid profile either. So you can probably use that long term.
That doesn't include testosterone, though, of course, when you say that.
Well, I'm talking about using the Anavar on top of the standard replacement dose.
Gotcha.
The sole purpose being to bring up the free testosterone by lowering SHBG.
Yeah.
But there, that said, there are other options you could do that too. We mentioned before a high protein diet. Getting your estradiol down to about a 15 to 20 picogram per milliliter level, and there's something called stinging nettle which is a supplement over the counter here in the States that can also, and don't ask me how we figured this one out, but how we stumbled upon it, but that can also lower SHBG. And there are other things like danazol, which is something we use for more often for females than anything else. I'm not even sure if it's actually classified anymore as an anabolic steroid, but it is a steroid that can be used, which actually will have zero anabolic benefit, but would have the same effect of lowering SHBG. So cool. I think that answers the question there.
Awesome. Thanks, Doc. Doc, you wanted to add a little something to the previous question about the cycling.
Yeah, no, you brought it up, and it's a good point, and I didn't go there when I should have, but the idea that you were bringing up of the difference between using these anabolics and cycling them versus using them as replacement therapy or with replacement therapy is important. I touched on it a bit, but the reason why we cycled on and off of these substances, for example, if you didn't need them, if you're 20 or 30 years old, don't need replacement therapy, is because you're trying to get the super physiologic benefit of more than what you need, and certainly a substance you don't necessarily need, for athletic benefit typically, and then you get off them in time to sort of fool your body and allow your body to resume its natural function. You're trying to preserve testicular function, okay? At 40, 50 years old or whatever it might be, where you need testosterone replacement therapy because, I always tell patients, don't shoot the messenger, but there is no natural function to preserve because your endogenous production is in the gutter, then you still need to cycle an anabolic steroid because of the lipid profile.
What could happen if your lipid goes too low for too long? What would?
Oh boy, you're bringing up open up a big can of worms there, because it goes into the whole thing about cholesterol.
Right.
We have an association a correlation association, whichever word you want to choose, between the higher levels of bad cholesterol and the lower levels of good cholesterol and the buildup of plaque in the arteries, coronary artery disease.
Yeah.
And the latest is we use a ratio of HDL cholesterol to total cholesterol as the best gauge for that. But it's still an association, a correlation, because we've gone over this before, I think. The building blocks don't make the house per se, in the sense that, I could put a bunch of building blocks on your front lawn and you wouldn't expect a guest house to build itself. you need a contractor.
Yeah.
Inflammation is what we know now is the driving force for coronary artery disease, this plaque buildup. It's been logical for many years, since the 70s at least, to say, hey, you don't want a house built? Get rid of all the building materials. And I use the example, you don't want a crack house in your neighborhood built? Okay, get rid of the building materials. But those same building materials also build schoolhouses. So it's kind of like, throwing the baby out with the bathwater thing when you get rid of all the building materials. It's logical to do so. If you're trying to get rid of any possibility of building plaque in the arteries, get rid of the building materials. I get it. It's also irrational for the reasons I just expressed. It's better to just say, hey, no contractor is allowed to come to this neighborhood and build crack houses, right? So you control the contractors, in other words, control the inflammation. That being said, the standard of care has been this, again, at least since the 70s, hey, let's keep it lower. Now, it's also very important to point out that once you have established coronary artery disease, you've got the plaque, it shows, in the carotids, or, even more specifically in the coronary arteries. Then, as I like to tell patients, the web page that says that statins don't work to either stop or reverse plaque buildup in the arteries is right next to the same web page that says that no Jews were killed by Nazis in World War II and we never really landed on the moon. We know that the statins work, and then we get back into that sort of, hey, this is the logical way, and it also really is the rational way, particularly for someone who's on replacement therapy, because cholesterol, as you know, is one of the building blocks to make that good substance, the schoolhouse for testosterone. But if you're on testosterone replacement therapy, you don't need it for that anymore. So it's okay to go ahead and press those cholesterol numbers downward. And also, always, you're better off trying to raise your HDL, the non-inflammatory cholesterol. It's made from omega-3 fats typically, those that are non-inflammatory, versus the LDL cholesterols, which you want to reduce because those are pro-inflammatory.
Gotcha. Very cool. Thank you, Doc.
Sure.